Dr. Ashish Gosar. I'm a consultant neurologist and epileptologist at Athena Hospital, Baikla. Most important thing is to realize that people with epilepsy, there is a lot of stigma associated with this. So what we are trying to do is create awareness so that even those who do not suffer from epilepsy, they accept people with epilepsy just like any other normal people. It can happen as early as on the first day of life, and it runs across all ages. Only the reasons and the causes are different, which can be genetic or hereditary, or sometimes there may be no family history. But it's an event which happens suddenly, where a patient may just lose consciousness, fall, may have jerky movements, and there are different types of these seizures. Some people call it fit, some people call it seizure. In Marathi, they call it akdi. When a person throws 2 or more fits, which are 24 hours apart, then we label this person as having epilepsy. For example, somebody may just have some confusion for a few seconds and may recover. Somebody may just be blank for a few seconds, may recover. Somebody may just fall and get up again. This is most likely in cases where it starts in the entire brain altogether. But in such patients, the brain as such is overall normal. You do not find any abnormality when you do the MRI in these patients. Now, these are the second patients, who get an aura. So basically what happens, the trigger starts from one part of the brain and it is slowly spreading to the other part. Once a patient throws a fit in front of you, just make sure that the person lies down. You make the person lie down. Just turn the person laterally so that the tongue doesn't fall. Next thing you'll make sure is during the seizure, he doesn't bang his head anywhere. And the third thing is, do not cover up. Let the person breathe. If he's wearing a tie, just release it, let him breathe comfortably. And what you can do at the most is, do not put anything in his mouth. Do not put your hand, in the mouth. I think you need to understand that the brain which has thrown a fit is a tired brain. It will take time again to come back to normal. The person may remain confused for a few minutes after waking up. The person may not actually be aware about what happened to them. Just make sure you are with that person till you feel that the person is completely best to go and meet a neurologist or even a good physician. The trigger is different for different patients. You need to find out what is your trigger and then make sure you avoid it. And lack of sleep definitely triggers epilepsy. Anti-epileptic drugs that we give, these are basically to make sure you don't throw a fit. They don't treat the cause of the fit. We're trying to reach out to every individual in the society to make them aware that in today's time, in the modern medicine, there is a lot of help that is available medically, surgically. There are psychiatrists, there are psychologists who counsel these patients and make them aware that this is something which is in today's time as normal as any other problems, like diabetes, blood pressure.
I'm an epileptic patient myself. It was not easy. It took 5 years to get to no medication. You have to live your life happily and move forward and not let any infection, disease or anything as epilepsy also bring you down. You got to live your life.